Hello, everyone, and welcome. Today's presentation is hosted by the Assistant Secretary for Technology Policy, the Office of the National Coordinator for Health Information Technology, the Office for Civil Rights, and Altarum. The Assistant Secretary for Technology Policy, Office of the National Coordinator for Health Information Technology, or ASTP, is at the forefront of the administration's health IT efforts and is a resource to the entire health system to support the adoption of health information technology and the promotion of nationwide standards-based health information exchange to improve healthcare. The Office for Civil Rights, or OCR, ensures compliance with our nation's civil rights, conscious and religious freedom, and health information privacy and security laws by investigating complaints and conducting compliance reviews, requiring corrective and remedial action, promulgating policy and regulations, and providing technical assistance and public education for the American people. Altarum is a nonprofit organization that works with federal and state health agencies and foundations to improve health outcomes. My name is Dawn Bishop, and I'll be providing a brief overview of the SRA tool, then passing it on to my colleague John Christensen to highlight some of the new updates in this new version. Nick Heasters from OCR, Mauricio Lovelace from ASTP, John, and I will be available for Q&A after the presentation. Please note that all attendees are muted. If you have questions during the presentation, please use the question box in the GoToWebinar interface. We'll try to respond to questions during the presentations if we can, and then we'll get to some after the presentation is completed as time allows. Just a few other additional housekeeping items. We are recording this presentation. It'll be published on the healthit.gov website as soon as it's available. If you're looking for a copy of the slides, they're located in the materials section of the GoToMeeting interface in the upper right-hand corner of the control ribbon. And if you'd like to access closed captioning, you can find that in the lower right-hand corner of your screen. Some of you may have already used the tool before, but today what we're going to cover is what is a security risk assessment. We're going to do an overview of the SRA tool, and then we're going to review some of the enhancements in the version we're releasing, which is 3.6, and then we'll get to some questions and answers at the end. So a covered entity or business associate must conduct an accurate and thorough assessment of potential risks and vulnerabilities to confidentiality, integrity, and the availability of electronic protected health information, or EPHI, that's held in the organization. So what does this mean? A covered entity is a health plan, healthcare clearinghouse, healthcare provider who transmits any health information in electronic form in connection with a covered transaction. This would include most healthcare providers, including doctors, clinics, hospitals, nursing homes, and pharmacies. Business associate is a person or entity that performs certain functions that involve the use or disclosure of protected health information on the behalf of a covered entity or another business associate. The security rule requires covered entities to maintain reasonable and appropriate administrative, technical, and physical safeguards for protecting patient health data. Specifically, covered entities must ensure the confidentiality, integrity, and availability of all EPHI they create, receive, maintain, or transmit. They must identify and protect against reasonably anticipated threats to the security or integrity of the information. They need to protect against reasonably anticipated impermissible uses or disclosures and ensure compliance by their workforce. The risk analysis is a component of the security risk assessment that covers assessment of risks and vulnerabilities of EPHI. This means identifying all EPHI within your organization, and that is data created, received, or transmitted. Identifying sources of EPHI, including external sources. These may be vendors or consultants. Identifying human, natural, and environmental threats to information systems that contain EPHI, as well as technical and non-technical vulnerabilities. So what are we hoping to accomplish here with the security? Organizations should use information from their assessment to implement security measures to design personnel screening processes, identify and strategize data backup, determine where and how encryption should be used, and determine what authentication may be required to protect data integrity, and determine which policies and procedures may need to be created or improved to protect EPHI. This is where the tool can help. Small healthcare organizations are vulnerable to attack and breaches in protocol that could put sensitive patient data at risk. The security risk assessment, the HIPAA security rule requires healthcare providers, health plans, business associates to conduct a security risk assessment and implement safeguards to protect patient data. While some of us have healthcare needs met by large organizations, which have plenty of dedicated staff and organizational structure to ensure strong security posture, there are many small providers who don't have the same resources. The SRA tool creates an opportunity and an accessible and easy to use tool to help practices identify and assess risks to their EPHI and suggest security measures to reduce those risks. Okay, we're going to take a little bit closer look at the tool. It's not going to be an in-depth discussion of all the technical features. We're just going to be a higher level overview. If you have anything that you'd like to learn a little bit more in depth about, feel free to put your question in the chat. You can review the user guide as well, or view one of our previous sessions on the ONC YouTube channel at healthit.gov. So a little bit about some background. So the content within the SRA tool comes from and is developed by these standards that we have listed here, which include the HIPAA Security Rule, HITECH Act, the NIST Cybersecurity Framework, and the three NIST special publications, HICCUP, HPH, and CPG. The SRA tool is available for download on the healthit.gov website, and we'll go through a little bit about how that happens next. Okay, few things to understand. If you're interested in trying out the tool, we can distribute a link here in the chat. Or if you're searching for the SRA tool online, make sure you're looking for the healthit.gov, which is the official website for ASTP and ONC. The SRA tool is a desktop application and can only be installed on Windows computers. Any modern computer running Windows 8, 10, or 11 should work. You'll need to have administrative rights on the machine to complete the installations. And instructions for reviewing the digital certificate will be covered a little bit later by John. Once you've clicked the download link on the healthit.gov, you'll get an installer. You can double click and run the installer and walk through the install process. Once the installer successfully completes, you will see the blue icon on your desktop, which will launch the SRA tool, and you can see that blue eagle icon there. For users without access to Windows or who otherwise unable to install the tool, we've developed an SRA tool Excel workbook, which might be a good alternative, and that's also available for download on that healthit.gov website. Okay, so this is what it's going to look like when you launch the tool for the first time. The tool lets you start a new assessment or continue a previous assessment you have already started. Today, we're just going to go over the process of starting a new assessment. So after you've clicked on new assessment, it's going to ask you to enter a name. This is really serves to provide an audit trail of who answered each questions, as multiple users can contribute to an assessment and each user can log in under their own username. There's no passwords, no credentials, so you don't have to worry about that. And then you'll need to select a location to save your file. The SRA tool is designed to open and save SRA files. SRA files are saved using a proprietary file format that can only be opened with the tool. I think it's important for everyone to understand that using the tool for the first time, it's important to remember where you saved your file. Make sure that you create a file for SRAs or just know where you have it saved on your computer in case you need to get to it again. If you need to work with your assessment outside of the tool, your results can be exported to Excel or PDF if you need to. So here's a little bit of information about the practice information section. Practice information is the first section of the tool where you're asked to enter information. In this section, the tool is trying to get users thinking about physical locations of their organizations and points of contact, their IT assets, which are the computers, the network infrastructure, medical equipment, and other electronic hardware. Also identifies vendors or business associates, so external organizations that you work with that may have access to EPHI. The screens in the section provide a basic inventory and relationship management. Some of these screens may be considered optional. If your organization has an IT asset management solution outside of the tool, it's just fine to maintain that. You don't necessarily have to enter all of your assets into the tool if you already are maintaining it in a different area. So just make sure that you enter any information that you think is necessary in here. And again, if you've got something outside of the tool, that's fine. The assessment section of the tool is the bulk of the SRA tool's content. It contains 7 sections with multiple choice questions, along with threat and vulnerability ratings at the end of each section. The assessment screens are laid out with questions at the top center, answer options below, which are radial buttons that you can click on, and education and references to the right. The education panel provides guidance related to each selected response, so this may change dependent on your answer. And the reference panel provides relevant citations to the HIPAA security rule, the NIST cybersecurity framework, HPH cybersecurity performance goals, and the health industry cyber practices or HICCUP. So after you've completed the questionnaire portion of each assessment section, you're going to see a section that's called threats and vulnerabilities. You're asked to select from a list of vulnerabilities that may be applicable to your practice or organization, and each selected vulnerability comes with a set of related threats. And then you're asked to rate the likelihood and impact if those were to occur in your organization. And then each section has a section summary, and this shows each of the questions, and the selected responses, and the education content. And questions are divided into areas of success and areas of review. The ones that are sorted into areas of success are those which represent a thorough and accurate assessment was completed and aligns with industry best practices. The ones that are in the areas for review represent responses that could use some improvement or need to be revisited in order to increase your security posture. As a reminder, questions are sorted into areas of success group do not necessarily indicate compliance with the HIPAA security rule, but rather that your organization is aligned with the industry security standards and recommended actions that help you protect and safeguard EPHI. At the bottom of each section's summary, you can indicate a section approval, which John will cover in a little bit later, and then add specific notes or comments. You may want to put where files are located in there, where you can find the policies and procedures. You can also save links to specific documents here by clicking on the plus sign. A special note, it's important to click next when you complete these. It triggers a save function, so it's important to click the next button. And now I'm going to cover some of the reports that were the 3 reports that we have available. So after the assessment sections are completed, reports are available. That means all 7 sections have been completed, and you'll notice there'll be a check mark next to those sections if they're fully complete. The summary report provides a high-level look at your assessment. Here you're going to see 3 graphics at the top of the screen. The risk score is the percentage of questions sorted into areas for review out of the total number of questions presented. The areas for review shows the total number of questions sorted into areas for review, kind of displaying the same information that's provided in the first chart. Vulnerabilities shows the total number of vulnerabilities you've selected as applicable for your practice. You'll also see risk scores for assessment section in terms of risk percentage. This is similar to the risk score shown in the first chart, but it's broken down by section so you can see at a glance which areas might need most attention. The risk report is a summary of all the areas of risks identified in your SRA. This means any questions sorted into areas for review or vulnerabilities you selected as applicable. In this report, impact and likelihood ratings are combined into a singular risk rating based on the risk assessment rating keys shown at the top of the report. The risk breakdown is a simple pie chart showing the risk levels of threats identified in your SRA. The top section of the risk report is dedicated to vulnerabilities, and the bottom section shows areas for review. Areas for review are listed by section and question number. The question, your response, and the relevant education information is shown on this report. The detailed report is a collection of all data captured in your security risk assessment. It includes each question and response, all the selected vulnerabilities and rated threats, your listed assets, business associates, and all notes and details that are captured in the assessment. They're all listed on this report. The report serves as an audit log, so each user who contributed to the completion of the assessment will be shown in this report with a date and a timestamp of when the question was answered. We recommend saving a copy of this report each time you do an SRA. You can export it as a PDF and save it that way. The remediation report lists all the areas of risk identified in your report, similar to the risk report, but it includes a space for users to document their response to areas of risk in their remediation activities. You might want to use this to note, assign an owner of the activity, a due date, link documents, or mark it completed. This section is completely optional for the user. It's not required. It's not going to stop any reports from being produced. It's just another way that you can document if you've identified any risks during your assessment, what you're going to be doing about it, and it has a nice PDF printed report. The SRA Tool Excel workbook is a set of interactive spreadsheets containing all of the questions and most of the content from the SRA Tool application itself. All 7 multiple choice sections are represented there. There's a threats and vulnerability section, and you can select the rating on those, and the same education references are found in there in that section too. And again, this is good for users who don't have access to Windows. So what should you expect when conducting a security risk assessment? Many users approach the tool not entirely sure what to expect, and that's understandable. We can't cover everything you should expect, but here are some tips to keep in mind. The first thing you should expect is to spend a significant amount of time completing your SRA, especially if it's the first time you're conducting one. There's many resources freely available to provide guidance, some of which are called out inside the SRA tool itself, but the process still requires an investment of time and effort. In order to complete an accurate and thorough risk assessment, you should understand your IT environment, how it's used in its daily operations, and what threats may be facing your organization. It's important to ensure your scope of risk assessment is inclusive of all PHI, EPHI in your organization. So look beyond your EHR into your practice management software, scheduling, billing, telecoms, any cloud apps that you have. And now I'm going to pass it over to my colleague, John, who's going to go over some of the enhancements that are being released in version 3.6.
Thank you, Don. And remember, if you have questions, you can submit those. We do have people who are standing by to help answer questions. There may be some questions that we hold to the end so they can be covered by one of our security experts that are listed as panelists in this webinar. All right, so let's cover enhancements that were released in SRA Tool version 3.6. This was released last week, so it is available from the healthit.gov website. You can go there. It's a free tool you can download. It's installed on your computer or on somewhere in your organization's system so that you or others or multiple people can access it at the same time. So for section review and confirmation, we've added functionality for users who want to confirm that an SRA has been reviewed and approved. This can be done at the end of each section and records the username and date when the review was completed. A pop-up will ask the user to confirm the action just to make sure that that's what you want to indicate. Note that this does not replace the record for who answered each question in the application in those 7 sections. It simply lets users record a section-by-section approval record if needed. This is functionality that was requested through the help desk and in last year's webinars. The new section approval record is shown in the detailed report PDF at the bottom of each section. It shows the reviewer's username and the review date. And again, this is separate from the username and audit date for each individual question. The report covers have also been updated with disclaimers that show the NIST HICCUP HBHCPG standards that are used. A small change has been made to the scoring scale to match the NIST risk management framework. In the past, it was medium was the intermediate scoring scale, and we've changed that to moderate. This change came from a user suggestion during last year's webinars as well. So you will see moderate throughout the tool and in the workbook where it was medium in the past. The SRA Tool 3.6 includes content improvements to questions, responses, and education. There was one question, which was section 5, question 18, that was removed since it duplicated an earlier question very closely and was determined that it was not necessary. Other examples of changes include adding operational technology, or OT, where IT is referenced in the tool, and changing mentions of antivirus software to malware protections, which is a more general and modern way to refer to them. The SRA Tool 3.6 installer loads updated library files that can mitigate vulnerabilities present in outdated components. Note that it is recommended that users uninstall existing SRA tool versions before installing new releases. There's also we are also providing information on how to access the digital cert. The digital certificate is not new, it's always been there, but we want to make sure that you're aware that you and your administrator can find the review and review the signed certificate before running the SRA tool installer if required. You can follow the steps shown here to confirm the authenticity and integrity of the software installation file. The cert will show as signed by Altarum Institute, and if it does not include the certificate, then it should not be installed. And you can reach out to us at the help desk. We'd like to remind you that this is only a tool to assist an organization with its review and documentation of risk, and therefore is only as useful as the work that goes into performing and recording the risk assessment process. The HIPAA security rules risk analysis requirements specify that organizations perform an accurate and thorough assessment of the potential risks and vulnerabilities to all of the EPHI the organization creates, receives, maintains, or transmits. For example, when responding to questions regarding passwords and authentication should be considered throughout the organization. It is not enough to only consider Microsoft's Active Directory password requirements, but organizations should also consider how authentication is managed in other areas, including authenticating to network and infrastructure tools and devices, authenticating to computer and application administrative accounts, and remote access. The SRA tool may not address all risks relevant to your practice or organization, and use of this tool does not mean that your organization is compliant with the HIPAA security rule or other federal, state, or local laws and regulations. If risks are known but not addressed within the tool, they can and should be documented outside the tool and linked to the tool using the Add a Document feature or any of the details or comment fields. Now we'd like to cover some frequently asked questions. How do I upgrade to the latest version of the SRA tool without starting over from scratch? The installer is designed to overwrite the previous version of the tool without issue. Files created with previous versions of the tool will still work. However, if you continue working on older files, you may be missing out on content updates, including new assessment questions, new education, wording, or other changes that appear in version 3, version 3.6 content. How do I update the audit date displayed in the detailed report? The audit date reflects the last date a question was updated. The audit date will only be changed if the response is changed. If you've reviewed and updated an older SRA files, the date of review can be included in your file name or date modified. And you can also use the new feature to confirm that a section has been reviewed and confirmed as accurate as of a current date when the user clicks that button. Is SRA tool available for Apple or Mac computers? No, the desktop application is not supported on Mac OS, Linux, or any operating system other than Windows. If you wish to use the SRA tool on one of those systems, you might consider the SRA tool Excel workbook. And another reason you might want to consider the Excel workbook version is that it provides you with all education and guidance for every single possible response to every question. Whereas if you download your detailed report, you will see the specific education for your specific response to each question. And also the Excel workbook can be useful if you need to copy and paste information elsewhere. Does the SRA file or report need to be submitted anywhere? Your SRA is for your own records. It may be required for an incentive program, but that is outside the scope of the tool. SRA files are not submitted to ASTP, ONC, or the Office of Civil Rights. All right, so that's our overview of the system and introduction to the SRA Tool 3.6 release, which, as I mentioned, is now available on the website. Are there any questions from the chat that you would like to address, Dawn or Kevin?
We have a couple that were assigned to Nick. I think, Nick, if you can see them, you might want to address those ones first.
Sure. So just looking at the question about, we get this question during most webinars, I think, is the question about how often is it recommended that the SRA be completed. So for HIPAA requirements, the security rule does not prescribe a particular cadence to doing the risk analysis. You know, we do have you know, guidance out there, and maybe we can post that in the chat again. We did yesterday that you know, talks about the need to keep the risk analysis updated and current. It talks about suggesting that your risk analysis process be an ongoing process in order to update and document the security measures as needed. You know, conducting a risk analysis to identify when those updates are needed. So, and adjustable frequency may vary among covered entities. So I'll just put this bit of guidance if folks are not familiar with it in the chat. It goes through a little bit of a discussion kind of at the end, right before the summary information about some of the recommendations for some of that cadence for doing a risk analysis. But that's only for the security rule. That's only for HIPAA. So there may be, other programs, other requirements, other things that may have a more, prescriptive cadence for doing risk assessments. So I would, check with whatever kind of programs that your office or organization is involved in that, requires a risk assessment to ensure that you are doing it on the required basis. So, I mean, there are, more than, only the security rule that requires risk assessments within the healthcare sector.
Nick, there was also a question about updating the questions based on changes to the HIPAA in 2025. Can you address that one too?
Sure. So the SRA tool does not reflect changes in questions related to proposed or potential changes to the security rule. There was a notice of proposed rulemaking at NPRM that was published earlier in the year, I think pretty early, I think in January. And those are only proposed changes. Those are proposed changes that were put out there for a public comment. So there was a comment period that was open. We received a lot of comments from the regular community and from the public at large. So we are working our way, through those comments. But more specifically, the updated updates to the SRA tool do not reflect anything that's proposed. There have been no changes to the security rule.
Nick, I know that we sometimes get a follow-up question about the timeline and cadence, how long to retain SRAs?
Sure. So security rule documentation is required to be kept for 6 years.
Don, do we have other questions or any other types of questions that would be useful to respond to all?
Yeah, I think that we get this question a lot too, is there's a whole lot of questions about how long does it take? How long does the security risk assessment take? And it really will vary based on organization. It will vary, as I mentioned, you'll want to make sure that you have an awareness of your IT structure, your infrastructure, your policies and procedures, all of those things when you're doing the assessment. I don't remember exactly how many total questions are in the SRA itself, but again, 7 sections. It varies by organization, so there's not a time amount that we can say to set aside. But what's nice about the tool is that you can get in today, work on it today, go and find information that you can, answer the questions more appropriately if you need to, and then come back to it the next day. So that's kind of what's nice about this file.
And another point that I would add is that in some sections, depending on your answer, you may skip most of the questions. So for example, section 1, if you click no to that very first question, you then jump to question 5. And if you click no again to that, you jump to the end of the section. So that allows you to complete it quickly. However, it also suggests that you have quite a bit of work possibly to address some potential vulnerabilities in that area.
And somewhat related, this is Nick again. We get this question usually on the different webinars, but and John, I think you covered it already during the presentation. But we're also asked if this risk assessment, if this the results of this tool, in and of itself shows compliance with the HIPAA's security rule risk analysis requirement. And the response to that is it depends. There's like Dawn was just saying, there's a lot of work to be done to meet the measure for conducting an accurate and thorough risk assessment. And there are maybe things that are specific to your organization that the tool doesn't capture, doesn't recognize. And as was said during the presentation, and as is included in the user guide, and I recommend folks look at the user guide. It talks about this in a couple sections, that it is incumbent of the user to understand the risks to your organization. So the SRA tool, its job is to help smaller organizations, smaller organizations, maybe less sophisticated organizations, to kind of understand risks that are present to EPHI within their environment. That's kind of common to those smaller healthcare organizations. But and if there are risks and vulnerabilities that are specific to that organization, that are perhaps more technical, so the questionnaire-based tool doesn't capture them, or that reflect newly adopted technologies that again maybe aren't in that tool because it is a point-in-time questionnaire, then just because they're not in the tool doesn't mean that they don't need to be identified and assessed. They do. So if there's not a place within the tool to do that, then there needs to be documentation to supplement the tool. So there needs to be, somewhere where you are going to do that identification, that assessment outside the tool, and then to keep that information as part of your overall risk analysis to supplement what the tool provides. And also to ensure that organizations can show that what they've done, that the work they've put into the tool is accurate and thorough. When the tool does roll up risks in the aggregate, and again, this was already covered in the presentation, but just to ensure, just to drive the message that where there are specific multiple areas of risk that the tool report shows in an aggregate, that the organization needs to keep that work product, because if OCR does want to see that you've done a risk analysis, OCR needs to understand that it was done in an accurate and thorough manner, and aggregate risk in the aggregate may not show that. So to the extent that you are able to provide that work product documentation that does show that risks were identified with specificity throughout the organization in a comprehensive manner, and it's only the report that rolled it up in the aggregate, then that can go a long ways to helping show, to demonstrate that the work that went into the tool, into the report, was done in an accurate and thorough manner.
Yeah, thanks, Nick, for covering that. I just want to cover that. That's one of the reasons why we put a remediation section inside the tool. It's just like Nick said, sometimes you may want to make notes in there of what the plan is to remediate the issue that's been identified. Maybe it's policies that aren't that need to be updated or become more current. That's one of the reasons why we put it there. But again, that section is optional. But as Nick said, doing the work isn't optional. If you find a risk, you need to find something and have it documented so that in the case of a investigation, you can show the steps that were taken to mitigate that problem.
One other thing that I'll answer, even though I don't think it's been specifically asked today, is about the outputs of the SRA tool. So if you go through and complete a security risk assessment, what are your outputs? What do you get from that? So there's a few things. There's you will save your SRA as a file. So the SRA file is what you can save with any username you like, or I mean, sorry, not any username, any file name you like. So it can be very specific. You can put a date on the file name so you know exactly what it represents. And then if you open that same SRA file up again, it will load all the information that you've saved there, but you can also save it with a different name, different file name. So you can basically start with the previous one as a template for the next one. Also, there are the reports. So when you've completed your assessment, you have the detailed report, which will provide all of the information that you've entered and all the answers that you've given and all the education and references that are associated with those. You can download those as either a PDF or as an Excel file. So if you want to have all of that text available for copying and pasting elsewhere, or you could download it as an Excel file, and then you'll have access to all of your answers and additional information that you've entered. Then you also have the other reports as well, but I think that the detailed report is the one that really provides kind of the full SRA in one place, and you can download that as a PDF or Excel file.
I just had a question that we haven't had before, but since it's asked, it may be on other people's minds. The question was whether or not once you completed the assessment, if you can go back in and make changes to it. And so as John mentioned, you're saving it as a .sra file. And when you open that up, all the information comes back in and you can go back through each section again as you want and make any kind of changes. So maybe you answered a question that when you went and did some investigating on and went, oh, nope, I need to change that. You can get in and out as many times. So it's like a file. It's not necessarily one and done and just complete and you can't make any changes to it. I think that was a really good question.
And related to that, if you look at this current screen right now over on the right, there's the flag this question for later is the last option at the bottom. There, you're able to select that, which means, you know, I can't answer that right now. Maybe you'll assign it to someone else. And there is a specific report that will show you all the questions that were flagged for later answering. So multiple people can use this. They should sign in with their own username, so you have that audit record of who answered what questions. There can only be one user in an SRA at a time, or you might break something internally if multiple people are making changes to the same SRA. However, you know, one person could complete it. They could either email it or share it across a network with someone else, and then that person could go in and answer questions. And with the remediation report as well, you can also assign things to specific people so they could go in and find what questions they are asked to enter. All right, do we have any other questions?
Just a quick question, John, you probably can answer. Is there a list of added questions from the prior version?
This 3.6 release does not have any new questions. It has one removed question, and then it has reworded questions and reworded guidance to try to be more clear. But there are no new questions. In 3.5, we added 5 new questions. But in this version, there are no new questions.
Hey, Don.
Yes. Yeah.
Yeah. So I got a question here, actually. So somebody was asking if if somebody performs a SOC 2 audit, would they need to use this tool essentially? So they're asking if it's going to be redundant. Right. So as we mentioned before, the use of this tool is optional, right? It's not required. But if you do have a SOC 2 audit, that pretty much maps to a lot of the NIST safeguards that would be required under HIPAA security rule. So to answer your question, right, it would, yeah. So you already have coverage. Just make sure that your SOC 2 is explicitly includes the PHI focused risk assessment too. And as long as that's covered, you should be good. Yeah, I wanted to answer that question. I got that in mind.
Great, thank you.
Thank you, Mauricio. So if we didn't answer your specific question or you think of follow-up questions later, you can also always email the SRA Tool Help Desk, and this next slide will provide you with the email address there. Also, the healthit.gov website for the SRA tool has links there where you can choose to email the help desk, and also you can submit questions there as well, the Health IT feedback form. I'm sharing some additional reasons.
Oh, sorry, John. I was going to say that I saw a couple other questions out here, I guess, in my queue. Let me get to these real quick. I think there was a question about with 3 offices, would you do an SRA for each location? I think that's going to be a depends question. As Dawn talked about, that there are areas within the tool that have been added, not this year, but they've been there for a while, to provide space, to provide space for text, that to enable users to provide the detail to show that what they're doing is accurate and thorough, that analysis and identification of risk and vulnerabilities that they are doing. If that is sufficient to cover 3 locations, then maybe that'll work for you. If not, then breaking it up into 3 assessments may be the better way to go. But again, that's kind of where the design of the tool is more geared to those smaller organizations, because at some point it becomes a question of real estate, of what you're able to enter into the tool to show that what you've done is accurate and thorough. So the larger your organization, the more locations you have, the more systems you have, the more EPHI you have, the larger your the exposure you have to different risks and vulnerabilities, then it just becomes unwieldy to have all that information in in these free text boxes. So you need to supplement the tool with other documentation, or do what you need to do to ensure that you can show that the analysis that has been done is accurate and thorough, if it is correct and comprehensive for your organization. Another question was just to confirm, completing the SRA in the tool, even without remediation, still doesn't mean an organization is compliant to the HIPAA security as it pertains to EPHI SRA. So I'm having a little trouble parsing that, but going through the tool does not guarantee that you're compliant with the security rule. So I mean the tool leverages the security rule to help organizations identify risks to EPHI. Depending on your organization, it may not identify all risks. It is a questionnaire-based point-in-time tool, so there may be new technology, there may be technical vulnerabilities that aren't reflected in the tool. So there could be work for folks to do to supplement the tool, but that's going to depend on your organization and how the tool is used, as far as showing your work, showing that the assessments that have been done, that are done, that they are accurate and thorough for identifying and assessing risks to EPHI throughout the organization.
Thank you, Nick. Are there
Sorry,
other
John,
questions?
to break in, but I just saw there are a couple questions out there.
No, yeah, that's great. That's helpful. Do you have others or other questions to answer?
No, I don't think so.
Okay. On the slide now is some additional information and resources that you can use to learn more about security risk analysis or assessments. We appreciate your time today. We hope that you will give the tool a try and reach out to us if you have questions. And we hope you have a great rest of your day. Thank you.